Warning signs before a heart attack. A heart attack occurs when the heart does not receive enough oxygen because blood flow is suddenly interrupted. The heart muscle cannot pump properly, and the tissue begins to die quickly. About 735,000 Americans have a heart attack each year. However, only about 27% of people know all the symptoms of the urgency of a heart attack. Recognizing the signs of a heart attack and get to the hospital immediately can mean the difference between survival, irreversible tissue damage, and death. If you have any doubt about whether the pain you are experiencing a heart attack, seek medical help immediately. Pay attention to chest pain. A chest pain, whether acute or dull, is the most common sign of a heart attack. People who have heart attacks often say they feel squeezing, fullness, pressure, stress or a strong feeling in the center or left side of the chest. This feeling may last a few minutes or more, or go away and come back later. Check that the discomfort in the upper body. Sometimes the pain of a heart attack radiates from the chest area outward, causing discomfort in the neck, jaw, abdomen, upper back, and left arm. The pain in these areas is usually a dull ache. If you have not recently worked out or do anything that may cause upper body pain, this pain could be a sign you are having a heart attack. The weakness of the body. One of the main symptoms to be aware of is the weakness of the body. Your body feels weak because the arteries narrowing is experiencing, which means less blood flow and circulation. This leads to weakened muscles that could cause it to fall more easily. This symptom is a big red flag, so be careful if you are experiencing bodily weakness. Dizziness and cold sweats. Dizziness and cold sweats are another sign that something is terribly wrong, such as poor blood circulation in the body. Part of blood flow to the brain are cut off. This restriction of blood flow is something to consider, as your body will feel sticky and discomfort. Your brain needs adequate blood flow to function properly and feels healthy. These symptoms indicate that a heart attack could be just around the corner. Monitor your breathing. Shortness of breath is a subtle symptom of heart attack, should not be taken lightly. It is distinct from the lack of air in relation to other diseases because it seems to come from nowhere. People who have suffered from the lack of air in relation to a heart attack describe the feeling as if they had been doing much exercise despite everything they've been doing is sitting and relaxing. Watch signs of nausea. Nausea can also lead to breaking into a cold sweat, and even vomiting. If you experience these symptoms, especially in combination with other symptoms, you may be having a heart attack. Cold or flu. If the symptoms of colds and flu are similar to what you are experiencing, there is a good chance that a heart attack is underway. Many people who have had heart attacks described suffering from symptoms of a cold or flu-like, just before suffering a heart attack. Chest tightness. If you have chest pressure, you will want to get checked immediately. Such as chest pain or discomfort is an important key to a heart attack. Good hit, pain or pressure in the chest you are maybe experiencing only increase as the potential heart attack is coming. Call emergency services immediately if you suspect that you or someone you know is having a heart attack. The sooner medical treatment is received, the greater the chance of surviving the attack. Don't risk talking yourself out of it or waiting too long.